Porte cahualti Cristo, que les
Did you know that indigenous people and communities are among Mexico's poorest people? This means they have from little to no access to health services, social security, housings, and sometimes even food. Chiapas is the state with the greatest degree of marginalization and poverty in Mexico. 74% of its population is in extreme poverty. The levels of mortality from infectious, curable diseases are the highest in the country. Diseases such as diarrhea, parasites, and the common flu. Nowadays, 8% of indigenous children still die from these diseases. These mortality levels are so high because most of the indigenous communities have never had access to the Mexican healthcare system, and according to the Ministry of Health, in Chiapas, there's only one doctor for more than 1,000 people. There is few to no health clinics, medication, or trained personnel that are accessible. The hospitals and clinics are far from these communities, and sometimes the roads do not even lead to them directly. After the growing difficulty of access to the healthcare system which these impoverished communities have to endure, this organization aims to promote a project that generates alternative health solutions to these various diseases. In order to meet the health needs of more than 45 indigenous communities, reaching approximately 15,000 people, and thereby reducing the percentage of the current malnutrition and mortality. The challenge is to advocate alternative health services directed toward prevention, provides solutions like improvement of diet and curing disease symptoms with natural and traditional medicine. The idea is to teach these communities which hospitals to seek the proper medical attention. This will be possible by training a group of health promoters within various indigenous communities, coaching women in prevention and nutrition issues, reviving traditional medicine, and improving the roads to the hospitals. These solutions will accomplish alternative health services, therefore covering the basic health needs of the community. In the long term, we will achieve the access to healthcare for more than 15,000 indigenous people like the Choles, Celtales, and Zoques, of all ages in Chiapas, Mexico. Reduce the percentage of mortality caused by curable and/or preventable diseases. Improve the nutrition of communities from local products they produce within the community. Improvement of the quality of life of 45 indigenous communities.
La Virgen lava pañal y los tiende en el romero, los pajarillos cantando, el romero floreciendo, pero mira cómo beben los peces en el río.